So the first technique for the suprahyoid area is a self-massage technique. For this, you will require a thumb. What you're gonna do is you're gonna take your thumb and you're gonna line it with the corner of your mouth, and you're just going to put it underneath your jawbone here. So I'm just doing a little bit of flexion here with my thumb underneath the jawbone. I'm not using a lot of pressure. If I want to go a little bit deeper, increase the pressure, rather than increase the pressure with my hand, I'm just going to tilt my head towards my thumb. And that gets a really nice area. So you would hold this area for as long as feels relevant. Once you're ready to move on, you can move a little bit closer to the middle. And again, just going to scoop the chin in a little bit, or the jawbone in rather. And then you're going to tilt your head forward, which gives you a little bit more access to some of those tissues. Find a tight spot and hold it. And then as you slowly start moving to the other side, you can start in the middle again, just underneath your chin here. Tilt forward. If you want to get a little creative, you can maybe add a little bit of a side tilt in there too. That feels so good, so relevant for me. Personally, I would hold this for anywhere between 30 and 45 seconds. But if it feels like less is better for you or more, by all means, do what feels good. And then the last spot would be aligned with the corner of my mouth here on the left. Just going to scoop my thumb in a little bit, tilt in, and that's such a great spot. And I would hang out here for a little bit. So that is the self-massage technique for the suprahyoid area. A really good fascial release for this area is a simple pinch of the tissue. So what you want to do is you're going to grasp the tissue here underneath your chin, very gently. Imagine the pressure that you would use to squeeze a peach without breaking the skin of the peach. So you're just going to grab the tissue here, and we're just going to pinch, pull forward. You can also pinch and pulling down a little bit. If you find that your hands are a little bit slippery, putting some hand sanitizer or even some baby powder on your hands will help to reduce some of that slide and give you a better grip. So pinch and forward, very subtle, but it feels really great. And you would hold this for as long as feels relevant. Alternatively, you can pinch and pull forward and down. And then if you want to, you can push to one side with that grip or push to the other side. I like to think about doing this exercise for about 60 to 90 seconds every other day or so. Remember, respect the injury, be patient with the process, but most of all, be gentle with yourself.